Hello, everyone. We are presenting an introduction to HIV, understanding the human immunodeficiency virus, presented by Rio, Cal, and Nisa. It's for our Microbiology 215 class. Our instructor is Dr. Nicole Luther. HIV stands for Human Immunodeficiency Virus. It is a type of virus that attacks the immune system, the body's defense against infection. HIV specifically targets CD4 cells, which are a type of white blood cell crucial for fighting infections. Over time, HIV can weaken the immune system, making it difficult for the body to fight off infections. HIV was first identified in the early 1980s. The virus was initially associated with a cluster of cases of a rare type of pneumonia and cancer among gay men in the United States. As the understanding of HIV grew, it became clear that the virus could be transmitted through various means, including sexual contact, sharing needles, and from mother to child during childbirth or breastfeeding. HIV quickly became a global pandemic, affecting millions of people worldwide. HIV belongs to a group of viruses called retroviruses. It is composed of a genetic material, RNA, surrounded by a protein coat. The virus also contains enzymes such as reverse transcriptase, integrase, and protease, which are essential for its replication and ability to infect host cells. HIV primarily infects CD4 cells by attaching to specific receptors on their surface and entering the cell. HIV is believed to have originated from a type of chimpanzee virus called simian immunodeficiency virus. The transmission of SIV to humans likely occurred when people hunted and consumed chimpanzees or came into contact with their infected blood. Over time, the virus mutated and adapted to human hosts, leading to the emergence of HIV. There are two main types of HIV, HIV-1 and HIV-2. HIV-1 is more common worldwide, while HIV-2 is primarily found in West Africa.
The life cycle of HIV can be divided into 7 stages: binding, fusion, reverse transcription, integration, replication, assembly, and budding. In binding, the HIV virus uses the surface protein GP120 and GP41 to bind to CD4 cells. In fusion, a pore is created when the HIV virus combines with the CD4 cell membrane. Reverse transcriptase is an enzyme that the HIV virus utilizes to change its genetic material from RNA to DNA. During integration, the DNA of the CD4 cells incorporates the HIV DNA. Replication: the HIV virus replicates its RNA during the HIV life cycle by using the machinery of CD4 cells. The first HIV variants are put together during assembly. The CD4 cell dies when the newly formed HIV variants bud from each, which is called the budding stage. The HIV virus primarily enters the body through mucous membranes and damaged tissue. It can be spread by vaginal or rectal mucosa, which is having unprotected sex with an HIV-positive person, or an anal intercourse, or someone who has bleeding gums or oral sores that have high viral loads of HIV virus. When an open wound or sores come in direct contact with the contaminated blood or other bodily fluids, and also sharing syringes or needles tainted with blood-borne pathogens poses a significant risk to drug injectors. Over 90% of new HIV infections worldwide occur through sexual transmission. The HIV virus directly affects the immune system, and secondary to the immune system, it affects respiratory, cardiovascular, neurological, hepatic, renal, and reproductive system. HIV targets and destroys CD4 T cells essential for fighting infections. HIV can directly damage the lining of the esophagus, stomach, and intestines, causing inflammation, ulcers, and diarrhea. Increased risk of pneumonia, tuberculosis, and other respiratory infections can be seen as an effect in respiratory system, while high risk of heart disease, stroke, and high blood pressure in the cardiovascular system. HIV can affect the brain and spinal cord, leading to cognitive decline, dementia, and nerve damage. Liver inflammation and increased risk of hepatitis B and C co-infection can cause the kidney damage, and increased risk of kidney failure can cause by the HIV virus. The pelvic inflammatory disease, infertility, and increased risk for cervical cancer in women is one of the other major risks of HIV virus. There are expected to be 38 million HIV positive individuals worldwide, with 1.3 million new infections that year. Sub-Saharan Africa is the most affected region, contributing more than 2/3 of the global incidence and prevalence. Considerable progress has been made since the peak in the late 1990s and early 2000s in terms of both prevalence and incidence. As per these statistics, in 2022, there were projected to be 38 million HIV positive individuals worldwide. This corresponds to roughly 0.7% of adults in the world between the ages of 15 and 49. The quantity of new HIV infections that happen within a particular community during a specific time frame is referred to as incidence. Globally, an estimated 1.3 million persons contracted HIV in 2022. When compared to the 1995 peak of new infections, this indicates a 59% decrease. HIV impairs immunity, making a person more vulnerable to several infections. An individual with HIV are more likely to get chronic illnesses such as hepatitis, TB, and several types of cancer. Issues with one's physical or mental health can have a substantial impact on one's quality of life. HIV has evolved into a chronic manageable illness that can be treated effectively, allowing patients to lead long, healthy lives. AIDS-related illness continue to claim lives, especially in areas with poor access to quality medical care and antiretroviral therapy. Even with ART, co-infections and other medical issues may increase the risk of death.
I will be going over clinical presentation, signs and symptoms of HIV. Early symptoms include fever, fatigue, headache, sore throat, muscle aches, joint pain, swollen lymph nodes, and rash. Chronic HIV symptoms may include oral thrush, genital herpes, HIV-associated diarrhea, and shingles. Treatment methods of HIV include antiretroviral drugs that slows the progression of the virus. Treatment regimen includes attachment entry inhibitors, nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors. Now I will be going over antimicrobials, name, and mechanisms of action. Antiretroviral therapy, ART, is used to treat HIV. It targets the virus directly and interferes with its life cycle in a number of ways to stop replication. There is reverse transcriptase inhibitors that are nucleoside/nucleotide. These resemble the organic components of viral DNA and obstruct the action of reverse transcriptase. Non-nucleoside reverse transcriptase inhibitors, These impede the reverse transcriptase enzyme's activity and stop DNA synthesis by attaching to a different location on the enzyme. There is fusion inhibitors. HIV cannot combine with or infiltrate host cells because to these, they target the envelope protein. Protease inhibitors, these prevent the HIV protease enzyme from working. Integrase inhibitors, these halt the integration and replication of the virus by preventing the viral integrase enzyme from producing HIV DNA into the DNA of the host cell. Treatments, modalities of HIV, surgery, physiotherapy, etc. Physiotherapy can help manage weakness, pain, or other musculoskeletal issues arising from HIV or its side effects. Surgery. This might be necessary for complications arising from opportunistic infections or other HIV-related conditions, not the virus itself. Other treatments include mental health support. Accessing mental health services can help people cope with stress, anxiety, and depression. You can get nutritional support. Proper nutrition and dietary counseling are crucial for maintaining overall health and managing complications. There are medications for opportunistic infections. Treatment focuses on specific medications targeting these infections depending on their nature. There is antiretroviral medications to prevent mother-to-child transmission, MTCT. During pregnancy, childbirth, and breastfeeding, specific ART regimens can significantly reduce the risk of passing HIV to the baby. As for preventative measures for HIV, there is abstinence. Refusing to engage in sexual activity reduces the possibility of sexual transmission. There is mutual monogamy. It is very successful to be in a sexually exclusive relationship with an HIV-negative partner. There is use of condoms. Using condoms correctly and consistently during oral, vaginal, and anal intercourse considerably lowers the chance of transmission. There are safety tips for needles and syringes. If injecting drugs, always use sterile equipment and never share needles or syringes. There are services for reducing harm. Make use of needle exchange programs and other resources to reduce the risks involved in injecting drugs. There are pre-exposure prophylaxis, or PrEP. This medicine can provide substantial protection if you are HIV negative but at high risk. Thank you for watching.